Hi, my name is Roland Bussiere. I am a SHIP, State Health Insurance Assistance Program Medicare counselor for Seniors Plus in Lewiston, Maine, one of the local area agencies on aging. I want to talk to you today about the Medicare Savings Program, also known as the Biennial, and the Dell program, which were recently cut in March of this year by the state. Initially, in March 1st, 2013, the state cut the income guidelines for these programs by 10%. When I first heard about these cuts, I said, what's the big deal? 10%, the state of Maine already had higher income guidelines than most other states in the country. So I didn't really feel that cutting it by 10% was going to be such a significant impact. However, after the folks that lost these benefits started coming to Seniors Plus for assistance, I realized what the true impact of these programs are. These programs are very complicated. Even the people that have these programs really don't understand the full benefits. So before I talk about some examples of how this affected some of our consumers, let me talk about what these programs are. The Medicare Savings Program, MSP, also includes three other programs: QIMBY, SLIMBY, and QI. If you qualify for the Medicare Savings Program, which is a federal program, and you have to be either 65 or disabled to qualify and be on Medicare, you also get two other benefits when you qualify for these programs. You get low-income subsidy and Maine RX Dell. Again, being a federal program, most of the benefits are subsidized by the federal government and not by the state. The state only actually pays 20% of costs, and the feds pay about 80% of these programs. These programs, all three, the buy-in programs, QIMBY, SLIMBY, and QI, will pay for your Medicare B premium. That's about $105 a month that Social Security will put back into your Social Security check. In addition, like I mentioned, it also qualifies you for LIS, low-income subsidy, which is a Social Security program. The state doesn't pay anything for that particular program. The Social Security covers it. And what that does, and it's just as significant for our consumers, it pays for their Medicare D premium. It pays their $325 deductible. It eliminates their donut hole. And the combination of the two programs, low-income subsidy and the Maine RX Dell program, the consumers essentially pay nothing for their generic drugs and pay $3.30 for their brand name drugs. So needless to say, if you lose the Medicare Savings Program, it's significant, but you also lose the LIS, which is in some cases even more significant. A couple of examples, folks that did come to see us. I had Mr. and Mrs. T. Mrs. T has diabetics. She's diabetic, and she also has rheumatoid arthritis. She was getting an infusion drug on a monthly basis. She went to see her doctor in March and said, hey, I lost my QIMBY. I'm not sure what this means, but I do need the injection, so could you schedule it for me? The doctor says, sure, no problem. The infusion drug is $3,000 a month. Losing her QIMBY, she was on QIMBY initially, now she's no longer on QIMBY. She now has to pay 20% of the cost, which is $600 a month for that infusion drug. Her husband has COPD, and it only has one lung. He is on oxygen and also is subject to the 20% copay for his oxygen. That's durable medical equipment. Combination of the $600 for infusion and approximately $200 for his oxygen, they simply can't afford it. She's going to go without her infusion drug, and I would say within the year she'll probably be restricted to a wheelchair. She's not going to be very mobile, and her health will deteriorate. I also had a gentleman come in, Mr. W, I'll call him. He came in and he lost his QI. QI, again, was paying his Medicare B premium, $104, and gave him the LIS, low-income subsidy benefits, along with the Dell program. And essentially, when you figure out what the state was paying for this gentleman, they were paying approximately $50 a month for his benefits. The $105 Part B is reimbursed by the feds, approximately 80%, and the Dell program was costing the state around $30 a month. So $50 a month is what Mr. W was getting for what they were costing the state for benefits. Now he loses that benefit. He has to pay the $104. His meds, he's on some Advair Discus, some some inhalers, etc., very expensive medications, is now going to cost him $465 a month to continue as he was when he had the QI program. So the state saves $50, it's going to cost him $465. So this is pretty, those things are pretty drastic. And now I hear that for 2014, the state is also looking at further reducing these benefits. They have cut QIMBY, the Medicare Savings Program, and the Dell program by 10%. Now for 2014, they want to cut it again. Not 10, not 20, not 30, but by 40%. They want to reduce it back to 100% of federal poverty levels, which is essentially a 40% cut. They also want to get rid of what they call the disregards. If people are close to qualifying, the state can currently disregard $75 for a single person, $100 for a couple. They want to get rid of that particular rule. There's something called ineligible spouse rule, where they can give people another $356 if only one spouse applies. They want to get rid of that rule. It's just drastic.